Hey guys, it's Jamie, and in this video, we are covering the continuing care module in Dentrix. This is such an important part of Dentrix and one that gets really tricky really easily. There's a lot of moving parts to it, so we're going to go through all of it, how to get it set up, how to attach it to your patient, and how to make sure that you're using it to keep all of your information accurate. So let's get into it.
Quick side note before we jump in, if you want an easy way to see where patients are falling through the cracks, I highly recommend MaxAssist. It's an AI-powered chart audit tool that reviews your charts and flags things like missing continuing care and overdue recalls. Offices use it a lot to clean up their systems, improve compliance, and honestly, it's just a clear picture of what's happening in your charts. I'll link a free AI chart audit and demo in the description if you want to check it out. All right, now let's get into the tutorial.
Okay, so first we're going to go into the continuing care setup. So to do that, we want to go into the office manager. And from here on the top bar, we'll go to maintenance, practice setup, continuing care, and then continuing care setup. This opens this continuing care setup screen. And here you can enter any continuing care type that you want. You can see our office has several in here. Really, we only use a couple of these. We used to use more, but we decided that we wanted to keep it a little bit cleaner, and I'll go into more about that in a little bit. But from here, you just set up your continuing care types. So to do that, you click New. Say in this case, we want to do bite wing, put in your continuing care type, and then type in your description. You can also change the initial status to any of these if you want to. I just usually keep it none and then change their interval. So in this case, for bite wings, we'll change it to 1 year. And then you can check mark this box to add 1 day or not if you don't want to. But this way, when you set your continuing care and you schedule their next appointment, it will take you out 1 year plus a day. You can change the provider if you want to, default appointment time. If you want this to always be a set amount of time for bite wings, it's typically in a hygiene appointment, but you can check mark that and then add how many units of time you want for this procedure. Then you can also change the display color. So color, pick any color that you want, and that is what color will be displayed here. Once you do that, you just click OK, and you can see bite wings as a type right here. You can also click edit if you ever need to make changes to this. Go ahead and change things up. You can delete them from here and then close the screen. So this, pretty basic, pretty simple to get set up. You just want to make sure that you have everything in here that you do on a routine basis. So in my practice, typically we have it set for exams, bite wings, prophy, perio maintenance, FMX, things that are done on a recurring basis. This is where you set all of that up, but next I'm going to show you how to attach it to your patients. So we want to open a patient's family file. Click that, it pulls up this test patient's family file. This block right here is for their continuing care. So right now there's nothing in it. You can see it's blank. You double click on it, it pulls up this screen. This looks very similar to the screen we were just on during the setup, but for this, it's actually connected to this patient. So anything that we set in here is just attaching the continuing care to that patient. So in this case, we want to set them up for everything. We'll do their bite wings, exam, FMX, and prophy. So you can select it and hit set, or you can just double click on the one that you want to set. From here, you want to select their due date. This is the most important part of any of it. A lot of times I actually don't fill anything else in. You want to make sure their due date is correct. You can also set their prior treatment, so the last time they had this. Once this is set up in your system though, this will be updating automatically as you complete these procedures, and I'm going to show you that too. You can change the status if you want to, provider and time. You can also add a note over here. So once you have the due date set, click OK. Want to add when they're due for their exam, so double click that, add their exam date, click OK. FMX, double click it, add their due date. Now these arrows here, you can type in the date, but you can also click these arrows and change the interval. So in my office, we do an FMX every 3 years. So I just changed that, but you can set it to whatever works for your office and click OK. And that will update your due date automatically. Click OK. And then we also want to set them on a prophy, make sure the due date is correct, and click OK. Now, when you close this, you can see all of the things that they are due for. This is all of the continuing care types that are attached to this patient. So when you're chart prepping or you're scheduling appointments, you can quickly at a glance see what your patient is due for and when they're due. This makes everything so much simpler when it comes to scheduling their next appointment and all of that. Now you can also see, let me change the date of this prophy. If they are overdue for an appointment, it will show up in red. So this way it alerts you that this person is overdue for this continuing care type. So in this case, this person is overdue for their prophy. You can very quickly and easily see when they're due or when they were due, so that you know when you're picking up the phone to make that phone call, what type of conversation you're having with the patient. Now this patient has their continuing care set up. Now let's talk about scheduling appointments. We also want to make sure that the continuing care is being attached to the appointment. This is super important if you want your continuing care to auto update for you. Okay, so we'll create an appointment. From here, we'll select this patient is coming in for an exam, bite wings, and a prophy. Click OK. If you're not familiar with setting up appointments or creating appointments, I do have a video on that. I will leave a link in the description if you want a run through on that. But for this tutorial, we are only covering continuing care. So we put our procedures into the appointment, and you can see up here, this continuing care box, this automatically added those things. If you click these arrows, you'll see what was added. So it shows highlighted the prophy, exam, and bite wing. These are all attached now to this appointment. So this box is the actual procedure codes that are attached to the appointment that will be posted to the ledger. But this box up here is what the continuing care looks at. So when you complete this appointment, it will update the date of when they're due next so that everything is set up correctly in your continuing care reports. Under here, there is this checkbox that says use reason to auto update CC. This has to be checked for it to automatically update your continuing care. So when you're creating an appointment, you want to make sure that everything that you're doing that day is also in the continuing care and that this box is checked. Click OK to set the appointment. It lets you know the continuing care exam is not due until June 13th. The continuing care bite wings is not due until December 13th of next year. Do you want to continue? This is a great alert. When things pop up, when you're scheduling appointments, I feel like so many people have the tendency to just click through to get out of it to get the appointment set. But they all mean something. And so many of these pop-ups are attached to continuing care. And I think that is what makes the continuing care messy for a lot of offices, is because people just click yes and they click through and they're not really looking at what the note said. So this is just a friendly reminder alert that you're scheduling this appointment too early, basically. In this case, I'm fine with it, and it sets our appointment. When we set complete this appointment, we'll go up here to set complete. It will ask us, create new continuing care appointment. This is because Dentrix has recognized that you posted procedures that were attached to this patient's continuing care. When you do that, it is automatically setting them up for their next due date. So if you click yes, it will automatically open a new appointment box. So you can set their next appointment. It automatically put in their exam and their cleaning, because those are both set to 6-month interval in their continuing care. It did not set bite wing. That's because that is set to a 1-year interval. And Dentrix recognized that. So it knows this is what they will be due for at their next appointment. So you can enter the date, time that you want to set their next appointment to, or you can just click pinboard. And that automatically pulls you out to their set interval. So in this case, it pulled us out 6 months plus a day. So I can just grab this off the pinboard and pull it into an appointment spot. The next thing I want to talk about is the types of continuing care. So in my practice, I like to keep this as clean as possible. So we usually only set continuing care for exam, bite wing, FMX, and whatever their cleaning type is, so prophy or perio maintenance. In my office, we take a full mouth every 3 years on our patients, and we alternate every 3 years, alternate between an FMX and a pano. So you could have continuing care types set up for an FMX and for pano, but just to keep it clean and easy, I like to just have it set for an FMX, and then I will decide what type of full mouth we are taking that day. I just like when Dentrix lets me know when they're due. So for an FMX, for example, I like that it lets me know this patient is due on this date, but I don't necessarily need it to differentiate between if they're due for an FMX or a pano. If you want it set up like that, you certainly can. You can go in and just add a panel to their continuing care as well. Click the due date, click OK. The reason I don't like this though is because you can see it doesn't say panel on here. It adds this plus. So in this box, it shows you 4 continuing care types. If there's more than 4, it shows you this plus sign. That lets you know that there are more continuing care types attached to this patient. And that is fine if that works for you. But I really like to just look at this at a glance without clicking into here and just seeing what they're due for and when they're due. So personal preference, I like to have it set up that way, but you can have Dentrix auto update Pano and FMX to both be recognized as FMX in your continuing care. You can also do the same with vertical bite wings and, a 4 bite wing set. So I'm going to show you how to do that. You want to go into the office manager. We'll click this. We'll go up to maintenance, practice setup, procedure code setup. This opens all of your procedure codes. So in the case of the FMX, find our FMX code and click edit. Right here in the middle, there is this auto continuing care box. If you click these arrows, it will pull up this screen. So I have this set that an FMX will auto update the continuing care for FMX, which makes sense, FMX. But I can also set that up for the Pano. So if I go to the Pano code, click edit, you can also set the auto continuing care to FMX. What this means is that when you post or set complete a Pano, it will auto update as an FMX in your continuing care. You can do the same thing for bite wings and vertical bite wings. Click in here. My vertical bite wing 7 series is set to auto update to bite wing. I like it this way because I don't need Dentrix to tell me what type of x-ray they're due for. My doctor and I will decide that. I just like for it to tell me when they're due. And so it makes sense to me to just have these connected. So each type of bite wing, same for 2 bite wings. You have a kiddo, you just want this 2 bite wing set. Also have this set up to auto update continuing care for bite wings. That way you don't need to have a continuing care type setup for 4 bite wings, 2 bite wings, 7 series vertical bite wings. You don't need all of that. You just need it to tell you that they're due for bite wings and when they're due for bite wings, and you can make the determination what type of bite wings you're going to take that day. Okay, to switch gears a little bit, I want to talk about running continuing care reports. So from the appointment book, this icon up here, this is the continuing care icon. So you click this, and this is how you get into your continuing care reports. So it will load and it will pull up your continuing care. From here, you can change any of the views that you want by going to this top bar, click views, and this is what the report will show you. So you can show all of them, patients that are due today, patients that are overdue, due next week, next month, 3 months, etc. You can also set these, personalize them for your office. And you can also select temporary view. With this, you can just set everything the way that you want it for this specific report. You can select their continuing care type. So if you only want to run a report for all prophies, select that with or without continuing care setup, status, scheduled appointment. You can run a report for patients that only have appointments or only without appointments. You can select the order and you can select any date span that you want. So the date that they're due, prior treatment date, last visit date, all of that can be changed here. So this is a great report if you want to find out who needs a prophy that doesn't have an appointment scheduled in this date range. You click OK and it will pull up all of the patients that fit that criteria. This makes calling on continuing care and getting your hygiene patients scheduled for their appointments super, super easy. So once you clicked OK, it will show you the date they're due, what type they're due for. If they have an appointment scheduled, it would be here. Their prior treatment. Patients' names will be in this column. They're blocked out for obvious HIPAA reason. It shows you their phone numbers over here, so you can just quickly make phone calls to these patients to get them set up for their next appointment. And if you want to change the views, like I was saying, you can customize these to whatever you want. You'll just click this top one that says Continuing Care Views Setup. You click that, and you can make anything that you want. So you click New, fill this in, give it a name, and then when you click OK, it will show on here. And it will also show on this drop down. So you can see our hygiene coordinator, she's already set patients that it's been over 2 years since their last appointment. They're overdue for perio maintenance without continuing care propy setup. These are ones that she's already customized for what she uses them for. Okay, so that was the overview of the continuing care in Dentrix. Like I said, a lot of moving parts to this one, a lot of things that you need to check and recheck and make sure everything is staying accurate in your system. It is something that can get messy very easily if you're not on top of it. But if you are, it is so helpful. It creates amazing reports so that you can really know when your patients are due, if they're overdue, be able to make those calls very quickly and easily. And also to know what you're scheduling for their next appointment. For hygienists, I'm scheduling their next 6-month appointment or their next 3-month perio maintenance. I want to know at a glance what they're due for at that appointment. So this all makes that super easy. I hope this helped you navigate that a little bit better for your office to help you keep things running smooth for your day-to-day. If you like videos like this, subscribe to this channel. I put out new Dentrix and dental tech tips and tutorials every week. So I will see you in the next one.
Quick side note before we jump in, if you want an easy way to see where patients are falling through the cracks, I highly recommend MaxAssist. It's an AI-powered chart audit tool that reviews your charts and flags things like missing continuing care and overdue recalls. Offices use it a lot to clean up their systems, improve compliance, and honestly, it's just a clear picture of what's happening in your charts. I'll link a free AI chart audit and demo in the description if you want to check it out. All right, now let's get into the tutorial.